Hi, I'm Bobby, and today I'll be discussing trauma and addiction through the lens of resilience with the preliminary topic of trauma, coping, and resilience informing culturally responsive practice for survivors with addiction history. I'm not completely sold on the title yet, it's a work in progress, but we'll continue on. After a few iterations, I've landed on the research question: what are the factors that influence coping and resilience among sexual abuse survivors with addiction histories? Some of the literature links sexual abuse as part and parcel of childhood maltreatment, which includes physical, sexual, or emotional abuse, as well as emotional and physical neglect occurring before age 18. So I am considering the implications of expanding the question to include maltreatment versus just sexual abuse or sexual violence against children. I am intrigued by this topic because I want to understand the factors associated with successful adherence to addiction recovery and sustainable strength based treatment methods for individuals recovering from abuse and addiction. Um, According to the literature, there are higher relapse rates when trauma is unaddressed. And this is important to note, and I'll talk about it a little bit later, because often abuse is not reported. It's stored down by individuals or manifests in other ways, like addiction, or coping manifests in other ways, like through addiction. Let's see. The preliminary literature review has resulted in various studies that have compelling statistics, such as people maltreated as children are 3 times more likely to present for treatment of substance use disorders by age 40. Just the fact that they are 3 times more likely to present for substance use disorders speaks to, in my opinion, like what we see over and over again is this sort of relapse and continual sort of cycle of people experiencing addiction and other substance use disorders. So, this might frame the narrative that childhood maltreatment, specifically sexual violence against children, is a subsequent causality of substance use disorders, this epidemic. The Institute for Health Metrics and Evaluation. So during my literature review, I came across some information from the Institute for Health Metrics and Evaluation. They conducted an analysis using the global burden of disease research. Their global study presented in Lancet revealed that 50% of sexual abuse occurs at age 15 or younger. The data that they collected was from 204 locations between 1990 and 2023. Um, Dr. Louisa Floor from the IHME states that survivors of sexual violence against children, or SVAC, have a higher risk of developing depression, anxiety, substance abuse, and other STIs and asthma. And there's an urgent need for effective prevention measures and responsive support. SVAC in 2023 was reported at 19% for women and 15% for men, which was largely unchanged since 1990, and is still an issue with prolonged ramifications like addiction as a coping mechanism. In the 1990s, psychologists Richard Tedeschi and Lawrence Calhoun introduced the post traumatic growth inventory. Um, the basis of the post traumatic growth inventory is about shifting the thinking of trauma exposure and resilience from a negative lens to a more positive lens, exploring the positive outcomes that are associated with trauma. The post-traumatic growth theory is a strengths-based theoretical framework that, excuse me, that I'd like to adhere to the work that I'm continuing on through this research. Subsequent to the post traumatic growth theory, Tedeschi and Calhoun and colleagues designed the post traumatic growth inventory, the PTGI. This is a way to measure positive outcomes related to trauma, and the instrument measures 5 different focus areas. One being personal strength, how people come out of trauma with better coping skills and strategies, relationships with others, spiritual and existential change, new possibilities, and an appreciation for life. There is an observation or a challenge that has been identified with the post-traumatic growth inventory, which is it's difficult to determine how and when post-traumatic growth occurs. Because growth from trauma is a lot like processing grief, there's no definitive timeline. It's more of a journey. So using the inventory helps identify some of those factors. According to the literature, relapse rates increase when trauma is ignored. You mentioned that a little bit earlier. And during my research, I came across the information from the FBI that reported that only 37% of sexual assault occurrences or rapes are reported. So that's less than 50% are reported, which indicates that, again, or correlates actually with the earlier findings that um, sexual abuse is underreported or not reported. Therefore, coping mechanisms or strategies are usually adhered to um, unaddressed or unattended outcomes or issues that are occurring because of the sexual abuse or any other kind of maltreatment. Recovery improves and is deemed to be more sustainable with culturally grounded approaches. These approaches could include things like, instead of treating only for detox when someone presents for addiction, treating for addiction and abuse, or excuse me, sexual abuse specifically. And again, that depends on whether or not the person seeking treatment self-identifies as being impacted by sexual abuse. Another pathway to treatment could be things like Sahin's 2009 narrative report on narrative therapy using optimism. So, in that literature, they talk about using the lens of optimism within the construct of narrative therapy in order to develop some resilience and coping factors. Um, there are some impacts that have occurred, some things to think about. In other words, there are 1 billion children globally estimated to experience sexual violence. So we know that this is not an issue that's going to go away anytime soon. And that was in 2022, which is just 3 short years ago. And 1 in 4 girls and 1 in 13 boys in the US as of last year are experiencing sexual violence. So I think there needs to be more consideration around um, whether we should create a national public health priority for this issue, and understanding that there are more than 25% of maltreatment cases are preventable. So there is some more to discover and think about, which I'll be looking forward to in my literature review and continued research. Thank you for your time. I appreciate it. These are some of my references, and I will talk more.